A 25-year-old male client presents to the emergency department complaining of severe headache, nausea, vomiting and knuckle rigidity. Nurse recognizes this patient may be experiencing some form of meningitis. Which test is the most appropriate to determine if this patient is experiencing the bacterial form of meningitis? A. Blood culture positive for Streptococcus pneumoniae. B. X-ray of the spine. C. Cerebral spinal fluid analysis showing elevated protein levels. D. Cerebral spinal fluid analysis to confirm elevated glucose levels. E. Computerized tomography scan of the head to assess for increased intracranial pressure. The answer is C. Cerebral spinal fluid analysis showing elevated protein levels. Cerebral spinal fluid analysis is the best test. Elevated protein, decreased glucose levels, with high levels of PMNs, polymorphonuclear cells, are indicative of bacterial meningitis, which is a medical emergency. Blood culture is appropriate but will not yield quick results. Computer tomography, CT, scan is also helpful but not priority. A patient is severely dehydrated and is being given IV normal saline at a rate of 160 cc per hour. Which of the following laboratory values would you expect to be abnormally elevated in this patient? A. Hemoglobin. B. Glucose. C. White blood count. D. Mast cell count. E. Creatinine. The answer is E. Creatinine. In a dehydrated patient, the BUN and creatinine is often elevated. Creatinine is a marker of kidney function. Elevations in creatinine from baseline are considered kidney injury. Dehydration is decreased circulatory volume to the kidneys. This will result in an elevation of creatinine and BUN on laboratory testing. Rehydration therapy with IV fluids will often correct this abnormality. What is the medical term for the artificial mechanism by which fluid and toxic solutes are removed from circulation when the kidneys are unable to function? A. Dialysis. B. BiPAP. C. Bronchoscopy. D. CPAP. The answer is A. Dialysis. Dialysis is an artificial mechanism used to filter the blood when the kidneys are unable to do so. The two major types are hemodialysis and peritoneal dialysis. Dialysis is usually considered in the treatment of chronic kidney disease and toxic overdoses. BiPAP and CPAP are used to help with respirations. Bronchoscopy is used to explore the lung space. The nurse is providing a teaching session to a client who has elevated uric acid levels. What type of diet will the nurse be teaching about? A. High potassium diet. B. Low purine diet. C. High calorie, high protein diet. D. High fiber diet. The answer is B. Low purine diet. Elevated uric acid levels is an indicator for a low purine diet. Other indicators include gout and kidney stones. The patient should restrict the diet to foods that are low in purine. A nurse wishes to reduce the symptoms of a client with systemic lupus erythematosus. The nurse should do all of the following except, A. Administer topical corticosteroids as prescribed. B. Instruct the client to use strong soaps to cleanse skin rashes. C. Administer a high iron diet and vitamin supplements. D. Instruct the client to avoid harsh sunlight and ultraviolet exposure. The answer is C. Administer a high iron diet and vitamin supplements. Certain diets can exacerbate systemic lupus erythematosus symptoms, including diets high in iron. Diet should not be high in calories, zinc, or fats. Compounds that may provide benefits include vitamin E, vitamin A, fish oils, selenium, and flaxseed.